Namaste. I'm Mary Colbert, and welcome to Dr. Colbert's Divine Health Podcast. And this is part 2 of the diabetic talk. We have so much information, we had to put this in 2 podcasts.
Well, again, this information is absolutely critical. So again, just pay attention because we kind of drill down deep. But we have found once you implement these principles, it is amazing how so many people, their blood sugar comes down dramatically, and many times diabetes and prediabetes go away. It is absolutely amazing. Many patients are able to come off their medicines entirely with the keto zone diet, especially the Beyond Keto diet, as well as the exercise program, as well as what I'm going to talk about, the supplements, and I call it the silver bullet. You're going to learn about the silver bullet today.
So this is an important podcast of continuation of reversing diabetes. Yes, you actually can do that. Stay tuned.
Okay, now we've talked about, let's kind of review, we've talked about the dietary program. We want mainly the healthy keto diet. It's in my book, Beyond Keto. You want to get on a regular exercise program. Now, there's a few key supplements, not many. There's just a couple of key supplements you need to win this battle. It's going to help lower your blood sugar naturally. So let's go over these supplements. Number 1 is fiber. Now, I talked about the glycemic index and how it's at the top of the scale of 100, but then white rice is just right behind it, as is corn flakes, as is baked potato and bread.
Yeah, but you don't like brown rice as much because it's high in
lectins. Yeah, and I'll talk about that in gut zone. But
that's
again,
why you don't like the brown rice.
Well, a little brown rice is okay unless
you
you have
prefer
gut
the white
issues. I
rice.
don't have gut issues anymore, so I can have brown rice. It doesn't hurt me.
Okay.
But a lot of people can. I see the people that are really gut sensitive and have food sensitivities. But for the majority of people, a little brown rice. But if you take brown rice or white rice now, it's going to raise your sugar. So it's like eating sugar. So
but it's in so many recipes,
right,
and part of what you eat.
But we got to get over the American thinking that we need 45 to 65% of our calorie intake is carbs. I call it garbage. It's garbage to your body, and it fuels diabetes. So you got to change the mindset and get to either a healthy keto diet or a healthy Mediterranean diet. I talk about both. Now, to get to supplements, number 1 is fiber. Now, fiber slows down digestion. It slows down the absorption of carbohydrates. So it literally lowers the glycemic index of any food you eat. And it also will bind the sugars. It'll bind the carbs. So again, you will not get the insulin spikes. Remember, it's when you eat that white rice or white bread or cornflakes or corn or baked potato, all of a sudden, boom, sugar spikes, insulin spikes. When you have the fiber right behind it, the fiber prevents the absorption, so you don't get the sugar spike, nor the insulin spike, nor the weight gain when you do it. So fiber covers a multitude of dietary sin. It also lowers saturated fats and lowers cholesterol dramatically for so many of my patients. We're not going to get into that. We're not talking about cholesterol.
Right.
But the key is the fiber, a tablespoon of fiber in the morning after breakfast, and then a tablespoon after dinner is usually sufficient. Oh, now, if you eat a lot of carbs or some starches at lunch, take it after lunch. Just separate your vitamins for about an hour from it. That's it. That's all you do. Now, for women, we recommend at least 25 grams of fiber a day. A tablespoon of this fiber contains about 10 grams of fiber. I make mine a heaping tablespoon. So you get a tablespoon twice a day, you're getting about 20 grams of fiber. That's enough for a woman. That's great. Women need 25. Men need 35 grams of fiber a day. So I'll usually take it 3 times a day, okay? So I get plenty of fiber. It also is great for your gut. It prevents constipation, prevents diverticular disease, hemorrhoids, etc. So other foods high in fiber are peas, beans, lentils, berries, oat bran, and oatmeal. But these are high in fiber, but also they contain carbs. They can throw you out of ketosis. So you got to be careful, but those are good for a Mediterranean diet. But if you're trying to lose weight, you don't want to eat those until you get your goal weight, okay? So I discussed that in detail. The next key nutrient we need is chromium. Now, chromium is required for normal metabolism of sugar, carbs, and starches. And when you process food, the processing process removes most of the chromium from the food. And we need chromium, which is insulin's little helper. It helps to lower blood sugar. And Dr. Richard Anderson was chief chemist at the USDA. He conducted a lot of studies on chromium in rats. And he found that the chromium dose is so easily tolerated and it's so innocuous. There was no discernible toxicity in chromium in rats that consume levels up to several thousand times the dietary reference. And he recommended higher doses. He said that many people just recommended 200 micrograms of chromium a day. He says that's not enough. You need more than that. And generally, he'd recommend dosage of 200 micrograms twice a day, or even 400 to 500
How do you get
milligrams.
chromium?
We get it through a supplement.
Okay.
And so what I recommend is usually 400 to 500 micrograms of chromium twice a day, and it helps to lower blood sugar amazingly
and you get that
well.
at a health food store.
You can get it at a health food store. We're going to talk about a product. In a study, they found that chromium picolinate, 200 micrograms twice a day, decreased the average blood sugar level in group 1 participants after 1 month from 179 to 106. That's better than most any diabetes medication, Mary.
Wow.
The chromium is amazing. I've been using this for decades in my diabetics. Now, not type 1, but type 2. The next
Can
supplement.
type 1 take them?
Type 1 can take it too.
They can take
Yeah,
it. So,
they can,
okay.
sure.
Gotcha.
And alpha lipoic acid, now this is important for every diabetic. Alpha lipoic acid is one of the most amazing antioxidants known to man. I've been recommending this for decades, for at least since the 1990s. I've been using this in my patients with diabetes. Now, here's what it does. It works in both the water-soluble and the fat-soluble compartments of the body. In other words, it works in the cells, in the brain, in the fatty tissues throughout the body. And what it does, it regenerates the vitamin C, the vitamin E, the glutathione, and the CoQ10, so it can be reused over and over in the body. It also improves insulin resistance, and what it does, it protects the nerves from diabetic neuropathy, from sugar getting in the nerves and damaging the nerves and causing numbness and tingling and burning pains and diabetic neuropathy in the toes and feet and fingertips. It starts to literally reverse diabetic neuropathy.
Wow.
Every patient with type 2 diabetes should be on this.
What is it?
It's alpha lipoic acid. Now, alpha lipoic acid is found in a supplement. Now, you can get alpha lipoic acid 300 milligrams twice a day, or some people only need 200 milligrams twice a day, or some people need 300 milligrams 3 times a day. You can get it cheap online at like VitaCost or Swanson or NutriCost or one of those places online. It's cheap. Those two are critical and they're inexpensive. Okay, so those will help protect you against diabetes, and they'll lower your sugar and protect your nerves from diabetes. And protect your whole body. It protects the eyes, it protects the arteries, it protects the heart, the brain from the effects of diabetes.
Does this supplement have all this in here?
Yes, it does. We're going to talk about that in a minute.
This is a combination of what you're talking
I
about.
got one more before we talk about that.
Ah, okay.
The next one is cinnamon.
Sorry.
Cinnamon reduces blood sugar. One of the best cinnamons is Cinnulin PF. It's a cinnamon extract that contains the active component of cinnamon because some people are highly sensitive to cinnamon and they can't take it. They get a toxic reaction to cinnamon. But Cinnulin PF is a cinnamon extract that most people tolerate really well, and they usually need about 250 milligrams twice a day. Now, it just so happens this diaxanol, and you can probably get it online, diaxanol, D-I-A-X-I-N-O-L.
By Ortho?
Orthomolecular, and you take one twice a day. It has the chromium, alpha lipoic acid, and the cinnulin in it.
Again, this is not our product.
It's not my product,
We
but
have
it helps.
no connection with
It helps a lot of
this.
diabetics.
We're
Or
just trying to help you.
Or to save money, go to Swanson or VitaCost or NutriCost or one of those and get each individual compound and take it and watch your sugar drop.
Yeah.
The next one is berberine. My berberine. Have you heard of berberine, Mary?
No.
I use berberine a lot in my practice.
It's not in this.
It's not in that.
Okay.
But when people when their sugar is not coming down, I'll add berberine, or the
Okay.
one I use is Berb Evalve, E-V-A-I-L, Berb, B-E-R-B-E-V-A-I-L, and it's a bioactive compound found in golden seal, the herb golden seal. And golden seal I'll use a lot of times for bacterial overgrowth in the small intestines, and several shrubs from the berberine genus. Several studies have found that taking 500 to 1,500 milligrams of berberine daily may lower blood sugar up to 20%, which is amazing. That's better than most meds. So I usually start them on 500 milligrams once or twice a day and go up to 500 milligrams 3 times a day. And a review of 14 studies found that berberine lowered blood sugar levels and seemed to be as effective as most diabetic medications include metformin, Avandia, and glucotrol, which is amazing. When you combine the chromium, the alpha lipoic acid, the cinnamon or cinnulin PF with the berberine, oh my gosh, it's amazing how it brings that sugar down. And those are inexpensive. Those are fairly inexpensive. You get them cheap online, folks. The next, and again, some people, we talked about advanced glycation end products. These are the products, women, if you're diabetic or pre-diabetic, you are aging at warp speed. Why? Because that high sugar is creating advanced glycation end products, because that sugar combines with the protein in your skin and in your body and forms wrinkles. It forms deep wrinkles and crevices throughout your skin and saggy skin. The Carnosine, Carnosine, literally prevents those advanced glycation end products from forming. That's why it's critically important in diabetics, and it also helps to lower your blood sugar. So it really, my women, it gets their attention. It's also good for men. Now, again, that helps especially in the wrinkle formation and the aging. See, diabetes doesn't just age your skin, it ages your brain, it ages your kidneys, it ages your nerves, it ages your arteries, it ages every organ in your body. The Carnosine helps to prevent that. It slows down that aging process by prevention of those advanced glycation end products. When combined with the alpha lipoic acid, the chromium.
So this Carnosine, you can get this from the health food store.
Yeah, you can get that at health food store, exactly.
Okay.
So how much do you need? You need about 500 milligrams twice a day. And it's fairly inexpensive, and you can get it at health food store or Swanson, Vitacost, Nutricost, one of those companies, okay? The next way to help lower your sugar is optimizing your hormones. Years ago, I wrote a book called The Hormone Health Zone. Hormone Health Zone. Dr. Colbert's Hormone Health Zone, about 5 years ago. And what we found is that by balancing and optimizing your hormones, it improves your health and your longevity and prevents disease. It just so happens by optimizing testosterone levels, testosterone helps increase the effectiveness of insulin. So insulin works better. It actually decreases insulin resistance by optimizing testosterone levels in men and women. Now, if your testosterone's too high, especially in women, it can cause insulin resistance. So you don't want to get it too high, or you don't want to get it too low. You want to get it in that hormone zone, I call it, okay? And I talk about how to do that. Low levels of testosterone in males have been shown to be associated with increased risk of type 2 diabetes. When I see men with increased belly fat and low testosterone go hand in hand. When we bring that testosterone up to an optimal level in my men by using pellets or shots or creams, it's amazing how these men, their energy comes back, their vitality comes back, their muscle comes back. And remember, the more muscle you have, the lower the sugar goes. It sucks the sugar out of the blood. So it also helps my women. When we put women and men on testosterone, it's amazing how those adrenal glands that were once weak, they're tired, they're exhausted. It's like giving them a boost of energy. It makes my men and women become, even though they're in their 60s, 70s, and 80s, and even 90s. I have one lady who's over 100. I have them on testosterone. It's their most important nutrient, testosterone and CoQ10, which gives you energy and helps those muscles and especially helps your adrenals. So don't forget the testosterone, even for women. I use it for women. It's amazing for women. The older you get, women, every woman over 65, I think, should be on testosterone because it'll keep your energy up. It'll protect your brain from Alzheimer's. It'll keep your muscles up and protect you from diabetes and prediabetes. But the big thing it does, it works like adrenal desiccated. It boosts adrenal function. Amazing. Testosterone replacement therapy decreases insulin resistance and improves blood sugar control in men with low testosterone levels. Also, real important for men and women is optimizing one's free thyroid or free T3 level. I'll talk about this in detail in Dr. Colbert's Hormone Health Zone. So many people over 50 have a sluggish thyroid with cold hands, cold feet. They lose the outer part of their eyebrow. Their body temperature goes low. They go to their doctor, their temperature, they say it's 97 or it's 96. And they say, oh, that's normal. And then they go to their doctor and they check just one thyroid test, your TSH, which is your pituitary thyroid. They say, oh, it's normal. But doctor, my hands are cold. I'm gaining weight. My skin is dry. My hair's falling out. I've lost my lateral eyebrow. well, we'll just wait till your thyroid's not working at all. Then we'll give you then they give you the wrong medicine, which is Synthroid or levothyroxine. It does nothing to boost your metabolic rate. So many people have suboptimal thyroid. Now give them a little bit of active thyroid and boom, we turn that thyroid on, they start losing weight.
And let me just say this. I know that some of you that are watching this right there, now you may be getting angry going, why isn't my doctor hasn't told me this? Why doesn't, why hasn't someone explained this before now to me or whatever? Let me just tell you something. The medical community is so inundated with so many problems, I can't even begin to tell you.
Well, it's driven by the pharmaceutical industry, which wants to get you on a medicine, keep you on that medicine the rest of your life.
And the doctors, in their defense, they do not have the time to do what Don does in research. Don spends so much of his time in researching different avenues of healing for the body. He's not in this box. He's not in the pharmaceutical box. And unfortunately, that's what's happened. The enemy has got the doctor so inundated with paperwork and so many patients. And my heart goes out to the doctors.
The paperwork is overwhelming. It is, even for me.
I am like, folks, you have no idea what's happening to our medical community. It's very sad.
Doctors are, they're dropping out of medicine. It's too much.
They're overworked.
Overwhelmed.
They're underappreciated.
Underpaid.
They're underpaid. They're misinterpreted. And we've got to have a reset in our health. We really have to have a reset in America with our health care system. And I don't know what it's going to take to hit the reset button, but we need one. We need one quickly. And so what Don has done is he has tried to bring about the most current information and research that he spent on his own together. But that's why your doctor doesn't know this.
No.
Many of your physicians do not know what Don is sharing about this.
They don't know diet alone.
They don't know about diet. They don't know that there's other alternatives to helping your body.
And you know what's crazy? When they send patients for diabetic education, Mary, they put them on this crazy 45 to 65% of their intake is carbs. They have just literally locked themselves into diabetes. And it's just so frustrating. I quit sending them that. I said, no, read my book. The Keto Zone.
I used to say Don needs to be our Surgeon General in the healthcare industry so he can go in there and reset the.
Well, we'd have to teach doctors nutrition
I don't want you in that
and
world.
diet. I don't want to be in that world.
I've changed
I'd rather
my mind.
do this. I'd rather do this. But let's talk about something amazing, folks. Some of you have been on the keto diet, even the healthy keto diet. You've exercised, you've optimized your hormones, you've taken these nutrients, but you cannot lose the weight. And I've seen that for patients, and my heart goes out to them because they have done everything they can and they can't lose weight. We have some of the most amazing breakthroughs now that I've got to share with you because it's very exciting. We now have this glucagon-like peptide. It's called a GLP-1 receptor agonist or glucagon-like peptide called Semaglutide, which is now in diabetic meds, including Ozempic and Rybelsus.
Okay.
And if you have an insurance card, you can get your insurance at a reasonable cost with your card. You want to ask your doctor if you can get started on either Rybelsus, which is the pill form, or Ozempic, which is 1 shot a week. And you start low and you go slow, you increase it. The Rybelsus, you start out with 3 milligrams for a month. You take it first thing in the morning, empty stomach. And then after a month, you go up to 7 milligrams. And for most women, that's all they need. But sometimes you have to go up to 14 milligrams because you start to lose weight once you get to either 7 or 14 milligrams. Women, it's usually 7. Men, they have to go to 14 milligrams. First thing in the morning, empty stomach. And what happens, the semaglutide, it works on your appetite center of your brain and suppresses your appetite once you get to the right dose. And so now Ozempic, the same thing. You start out with 0.25 milligrams IM the first month, or I'll start them usually a little higher at 0.5 to get them up to that magical dose. 0.5 milligrams IM, sub-Q the first month. Then we go to 1 milligram sub-Q the second month, and then 2 milligrams for the men usually the third month on. Once we get them up to that 1 or 2 milligram sub-Q injection once a week, after a few months, their weight literally, it works on the appetite center of the brain, suppress the appetite. They begin to literally melt like butter on a hot stove for so many of my patients. It's a major breakthrough, especially when combined with a Beyond Keto program, the supplement program, the exercise program, the hormonal program. And it's amazing how we're getting breakthroughs, Mary. And I'm so excited now for you that they can't afford it, you can't get it. We now are getting it from Canada. If you're a patient from mine, we use some of the pharmacies in Canada, which is a fraction of the cost of here in the U.S., so we're working with some of the Canadian pharmacies. Or our compounding pharmacy can make it into a sublingual tab, a semaglutide sublingual tab, and we don't have to use the higher doses, so it's able to save my patients a lot of money.
But the doctors need to recommend this. They have to.
Yes,
this is by
you need to get it from your doctor. And again, this is a new breakthrough peptide that is absolutely amazing at getting you over the stick point and helping you to lose weight. Once you get to that key dose, in Rybelsus, it's usually the 7 to 14 milligram dose of Rybelsus, and that's Rybelsus, Rybelsus. And for the Ozempic, Ozempic, it's usually the 1 milligram or 2 milligram injection. You only take the shot once a week. It's a little teeny insulin syringe. It's nothing. And you say, well, why can't I start at the high dose? Because it can cause digestive side effects. It can cause greasy stools, diarrhea, abdominal bloating, abdominal pain,
But you're telling me for
vomiting.
people who are overweight, they're obese, and they've
Mary,
tried every diet in
this
the
is
world.
a breakthrough.
You're saying that this is
Amazing. We are getting,
Okay.
especially when we combine it with everything else I talked about, the supplements, the Beyond
Wow.
Keto diet, the exercise program, the hormonal
America,
program.
you need this.
But one other thing we got to talk about is stress. When a person is stressed, their cortisol goes up. When you have high insulin and high cortisol, you have the dynamic duo for weight gain. We got to get the cortisol
You can look
down.
at America and see what's going on.
Well,
you sit in the airports and
yeah.
you watch the people that are going by, and you can tell
Well,
what's happening.
here's how you fix it. Number one, if your cortisol is real high, you have just locked yourself into belly fat. We have found that, again, your hormone balancing with or optimization with the hormones, especially testosterone, helps. But also we have these stress relief drops that are all natural that helps relieve stress. We also have Cortisol Manager. Cortisol Manager you can get online. You take 2 at bedtime and it brings the cortisol levels down for a lot of my
And
patients.
that's not our supplement either. That's
No, it's
just
not mine. You can
another-
get it online from Integrative Therapeutics. And also the adrenal desiccated. So again, there are 4 key things that help with stress tremendously. Optimizing that testosterone, using adrenal desiccated. For men, usually you need 4 twice a day. For women, 2 or 3 twice a day in the morning and at noon, along with stress relief drops, 10 drops as needed for stress. It works amazing to lower cortisol levels, and then Cortisol Manager at night, 2 at nighttime. That's amazing for lowering cortisol, because if you don't address cortisol, so many people are locked into belly fat and they can't break through. That's a breakthrough for a lot of patients. Last but not least, we are almost done, Mary, which is very exciting. We've been through a lot. I want to talk about
I know,
one
this is
other
so
product.
much. Yeah.
Some patients have a sweet tooth, and they come to see me, and they got diabetes. Their sugar's off the chart. Their hemoglobin A1C is over 10.
I'd say that's a lot of people.
That's a
most
lot.
people,
And
yeah.
Mary, we have the key for this. Now, semaglutide, that glucagon-like peptide agonist, is one. But for those people with a sweet tooth, they come to see me and they say, oh, Dr. Colbert, you know, I inherited this sweet tooth from my mama. She loved ice cream, and she fed me ice cream. She fed me Snickers bars and Reese's Pieces.
Now, are you going to cast a demon out?
No, I'm not going to cast a demon out. No. But they say, I just have this sweet tooth. I can't get rid of it. And I said, why don't you go to your dentist and have them pull that sweet tooth? But they look at me like, Dr. Colbert, what do I do for this sweet tooth? I can't get rid of it. Some people have had a major breakthrough with an herb, and it's called Gymnema. That's Gymnema, Sylvestre, just like Sylvester the cat, but Sylvestre. It's an herb that suppresses the sweetness when it's consumed, prior to eating a sugary food or beverage. And what it comes in a drop or a spray. People usually like the spray better. Not it can sometimes taste horrible for some people. You have to find one that's rated high. Just see which one has the highest star rating. And what you do is you spray it on your tongue at least 30 minutes before consuming any sugar, and you will not like the taste of sugar at all. But some people say, well, the taste of this stuff is horrible, so you got to find one that tastes decent. Okay, so
I don't know that people are going to do that.
Well, it's for those with a sweet tooth.
Well, Don, the people with the sweet tooth, honestly, you know.
Well, it's kind of like we've had children, and our son had problems with sucking his thumb, and we used to put this medicine on his thumb that tasted horrible, so he was less likely to suck it, but he just got smarter. So, and he found out ways to get rid of that on his thumb. But again, this is similar to that. If you have a real desire to stop it, then you can spray this on your tongue. And what it does, it literally blocks the sugar receptors on your taste buds. So you can't taste the sweetness.
When you're eating something sweet, it doesn't taste good.
It doesn't taste good at all.
Okay.
So it helps some people. Some of my patients swear by it. It takes about 30 minutes to work, and it lasts for about 2 or 3 hours.
Well, if you don't have natural control and you're sitting in front of a birthday cake or pies or some party.
You're going to a birthday party, spray it on your tongue, just put it all over your tongue.
When you go to take a bite, all of a sudden you won't want the rest of it.
Right.
So for those who have no control.
Yeah, so let's summarize. How do we reverse type 2 diabetes and prediabetes? It's so simple. Number one, follow a healthy keto diet, which is in my book, Beyond Keto. Beyond Keto is a book. It's a healthy keto diet you can follow the rest of your life. To lose weight, you can follow my Keto Zone diet. To educate yourself as to what to do on the glycemic index and also the supplements, my new Bible cure for diabetes. So first of all, you got to be on the right diet. Number two, you got to exercise regularly, not once a month, but at least 5 days a week, including both aerobic exercise like walking and strengthening exercise to build muscle. Remember, the more exercise, the more muscle you build, the more sugar it takes out of your bloodstream. And then the supplement, you want fiber. And we have our Fiber Zone, which is a delicious fiber.
Really, that's the only product that is ours we've even talked about.
Exactly.
So for those critics out there that think we are doing everything to promote just ours, you couldn't be more wrong. We promote whatever we believe works the best for the people.
Exactly. And then other supplements that really help are chromium, like chromium picolinate, usually 400 to 500 micrograms twice a day, as well as alpha lipoic, that's lipoic acid, usually 300 milligrams 2 or 3 times a day, and sinulin, PF, 250 milligrams twice a day. All of those can be found in this one supplement, diaxanol, 1 twice a day. And also consider adding berberine, 500 milligrams, 1 capsule, 2 or 3 times a day. And finally, Carnosine, Carnosine, 500 milligrams twice a day to prevent wrinkles and the advanced glycation end products formed from high sugar. And finally, optimize your hormones, especially testosterone and the active form of thyroid. I use the natural desiccated thyroid, such as NP thyroid, amazing. Find a doctor who does this for you, who can do this for you. Read my book, Dr. Colbert's Hormone Health Zone. It explains all about the keys to hormone optimization. And then finally, for you that have tried everything, it's not working, use your silver bullet. The silver bullet is semaglutide. It's a glucagon-like peptide 1 agonist. I know it's a mouthful. It's just a healthy peptide that once you get to the right dose, it literally turns off that appetite, or turns way down the appetite center of the brain, and your appetite goes and you start literally burning the fat right off. It's amazing how it works. I've had lots of patients on it. It's amazing for diabetes. It's actually used for diabetes. So again,
finally, they're getting some
This is a diabetic medicine that very few people use, but I use it especially in my diabetics because your insurance will probably pay for it, and it definitely lowers insulin levels. Insulin levels.
And you've got to go to your doctor. Tell them about this podcast. Make your doctors watch this podcast.
Well, the thing about this semaglutide, which is Rybelsus or Ozempic, these are silver bullets for both diabetes and burning fat. You got to start low and you got to slowly increase. You stay at the dose for a month. Once you get up to that magical dose, which is Rybelsus, it's 7 or 14 milligrams. For Ozempic, it's 1 or 2 milligrams. The key with Ozempic is only one little insulin shot a week. That's it. And it's amazing how the body literally starts to self-correct, and the diabetes usually improves or goes away, especially with the diet and with the supplements and the exercise and the hormones. That's a mouthful, Mary.
I know this is a long podcast and a lot of information, but we've had so many people request us to do this with diabetes because Don has been so successful
We've
with
reversed
so many people
thousands
in reversing type 2 diabetes
and prediabetes.
and prediabetes. It's amazing. So this was an important podcast. We ask you to help us, so we can bring more information. Don can do what he can do to bring you the latest cures and natural answers for your health. Go to drcolbert.com or divinehealth.com and help support us by our Fiber Zone and our products.
And also these books, The Bible Cure for Diabetes, the Hormone Health Zone.
When you support us with that, you're helping us stay on doing what we're doing because that's what we want to do.
These two are the most important. Beyond Keto book. This book I wrote 2 years ago.
Right.
And it is probably the most important book next to my Brain Zone that's coming out, as well as The Bible Cure for Diabetes. This just summarizes everything I talked about.
You also have a big book. It's Reversing Diabetes.
Oh, that's true. I didn't bring that.
You didn't bring that one, but we have a big book,
My
Reversing
Beyond
Diabetes.
Keto recipe book will be out in January of 2023. Real exciting.
A lot of stuff on our website. Go to our website and visit it. And we appreciate you watching this. And most importantly, share it. Share this podcast with your friends and your family. Get them the information. Get this to other people in the medical field. It'll help them in treating others. And let us heal the world.
Well,
help us heal the world. It needs healing.
Realize that the key thing we need to do is let our food be our medicine. Break the habit of the high carb, high sugar, high carbohydrate diet. Crucify your flesh, give your body what it needs and not what it craves. That's the key.
I think about the scripture, and this is important that we include this because everything we do, the basis of what we do and why we do is the Word of God. Mm-hmm. And one thing that's very sad to me is I read in the scriptures about a nation whose God is their belly. And I'm just telling you, America, we have become a nation whose God is our belly. You can look around the world, and this is not to condemn or judge. It's out of ignorance. It's out of stress. It's out of many reasons for it that we have become a nation that literally we've become more interested in just feeding our belly. And we've got to get back to the basis of what this country's about. And that's about being good and being righteous.
Be an example of Jesus.
And be an example to the rest of the world and for your children.
Well, they put the glutton and the drunkard in the same category in Proverbs, too. The drunkard and glutton shall come to poverty.
And this is not to condemn, but to correct. Because I want you to live long. God wants you to live long. He wants you to live strong. And that is the ultimate desire of the Lord. But you're in control. That's the reality. You're in control. And He's given that control to you. So begin to make the right choices. Begin to do the right things. And now you are being given the power and the tools to do it. Mm-hmm. So
I tell you this, I've been practicing medicine now for over 35 years, and these are the keys. And we see this, we see miracles every day, Mary. We see people, hear testimonies, people, I'm totally healed of my diabetes. Their doctors can't believe it.
Right.
Now, again, this is not for type 1 diabetics. Don't stop your insulin.
I know, you have stressed that, so I think that point's gotten across.
But God bless you.
Thank you for watching, and share this podcast.
And let us know what other subjects you're interested in, because, again, people literally, they called the office and said, you don't have a podcast. We didn't realize we didn't have one on diabetes, but they wanted a podcast on diabetes and gout. So we listened to you, and we'll definitely help to fulfill your desires in this regard.
Thank you. God bless.
God bless.